Hello guys, we are continuing our topic microbubble contrast agents part 2. So part 2 we will be discussing. Till now we know that what is a microbubble contrast agent, what type of microbubble contrast agent they are, how we give them. Now let us understand the physics behind it. We know with these microbubble contrast agent as USG contrast agents. So what happens? They should correlate with the USG waves. We know that sonographic waves are nothing but are the mechanical waves or mechanical sound waves. And these are basically mechanical, maybe they are longitudinal waves. We know about X-rays, that X-rays are what they are electromagnetic waves, but sound waves are mechanical waves. Mechanical waves are not harmful. So what happens when we are giving USG contrast agent in the form of microbubble? They are resonating with the movement of compression and rarefaction. What happens? We know that compression and rarefaction happens in USG waves or sound waves. What happens during compression? Molecules are tightly packed, pressure is high, and when the pressure is released, rarefaction happens, molecules are not tightly packed. So similarly, simultaneously with the compression and rarefaction of the USG wave, these microbubble change their shape. What happens when compression happens? Pressure increases, which lead to the contraction of this microbubble. And when the pressure releases, it leads to the increase in the size of the microbubble. As we are seeing, this is the microbubble acoustic stimulation. Suppose this is a probe. We have given the sound waves. What is happening here? There is compression, there is rarefaction, compression and rarefaction. What is happening on compression? When the pressure is increased on the A point, the size of the microbubble is decreased. And slowly on B to C, we are seeing that the pressure is releasing. When the pressure is releasing, means it is in the refraction phase, and in refraction phase, size of the bubble starts increasing, and at the point of C, we see that the microbubble size has increased. Again on D, the size is the maximum, and when again the pressure is applied and compression phase is coming towards E, it still start decreasing. So they are basically resonating with the compression and the rarefaction of the sound waves. So these microbubble contrast agent basically resonating and giving with the frequency of resonating frequency. But the thing here which is very important to know, that they don't follow the linear dynamics. They don't follow the linear interactions. These microbubble contrast agents, they follow non-linear interactions. Let us understand what happens in non-linear interaction. Moving further on the next slide, till we know that we are giving a particular amount of pressure so that the microbubble will contract and expand. On contraction only we are giving the pressure. So the question arises, how much pressure we should give? Because if you are pressing something, suppose you have a marshmallow, okay, you squeeze that marshmallow, and again when the pressure is released, marshmallow will expand. So how much pressure you will give into the marshmallow that it will expand? So that pressure is known as the peak refraction pressure. It is that little pressure on the bubble which determine how much the bubble will expand. If you give a more peak refraction pressure, what happens? More rarefaction will happen, more relaxation will happen, and finally this bubble sometimes get burst. So we don't need excessive pressure also. And suppose we give a very little pressure than the peak refraction pressure, what happens? There will be no harmonics generated. Why no harmonics generated? Because you have not given them enough pressure so that compression refraction can happen. So that for developing a harmonic, a good harmonics, to get a good signal, we should give the microbubble a particular pressure, and that particular pressure is known as peak refraction pressure. Now what is MI? Whenever you are having a USG contrast enhanced USG, you will be getting mechanical index on the monitor. Here it is written on the monitor that the MI will be this. This MI is basically nothing but the peak reflection pressure upon under root of frequency. So what is this peak reflection pressure? I have already told you. So this MI is directly proportional to the peak reflection pressure and this frequency is constant. So next, let us understand what happens when the MI changes. Suppose there is lower MI. We know that MI is peak reflection pressure upon under root of frequency F. So what happens? Under root of frequency is fixed. So it depends upon peak reflection pressure. When the pressure is low, small pressure variation is there. Whenever MI is inversely proportional to the frequency, when frequency increases, MI will decrease. When frequency decreases, MI will increase. So pressure decrease hoga. When pressure is decreasing, what happens? They are not able to resonate with the ultrasound waves on contraction. This is the and on rarefaction they'll expand. So what happens? They'll not expand that much and harmonic will not be generated. Harmonics will not generate. So now let us understand when there is low MI, that is less than 0.1, there will be no harmonics generated because it is less than the peak reflection pressure. When MI is mid, that is between 0.1 to 1, it is nearly to peak reflection pressure. So some harmonics will be generated, means they are compressing and relaxation is going to happen with the sound waves. When the MI is more than 1, greatest harmonic is generated because the peak reflection pressure is exceeded. The time will come when the bubble will expand so much and it will burst out. So during practical purposes, we should select a mid MI, that is between 0.1 to 1, so that a particular peak reflection pressure is given and they will be resonating with the harmonics. So good harmonics are created in the mid MI range. So whenever you are seeing a contrast enhanced ultrasound on the monitor, you will be able to see that MI is between 0.1 to 1. I was telling you about the linear interaction and non-linear interaction. What happens in linear and what happens in non-linear interaction. Suppose with the sound waves, this is compression. Molecules are very compressed. The pressure is so much high and the rarefaction, molecules are away from each other. Non-linear interaction, here the compression will happen, bubble size is small, and on rarefaction bubble size is more. And similarly they are propagating in the vessel, suppose like this, small, bigger, small, bigger. But what happens if there will be linear interaction? There will be size changes only. But what non-linear interaction happens, the size on compression, they'll compress to a particular size, but on rarefaction with the particular, again when we are increasing and we are giving the MI again and again, the size of the bubble is increasing on simultaneously, size is increasing in the next phase and next phase and next phase, and here how it start propagating through the vessel. So that's why a non-linear interaction is necessary than the linear interaction. Otherwise they'll not be able to move and they'll not be able to collect on the particular side where we want them. Since it is an intravascular agent, they have to move through the capillaries. Their size should be good enough to pass the capillaries also, and they should follow non-linear interaction. And the most important thing is that MI range will be mid 0.1 to 1. So that some harmonics will be generated and these harmonics should be resonating with the ultrasound. That's why this is also known as resonance harmonics. Contrast enhanced ultrasound follow resonance harmonics. So till now we get to know that how a contrast enhanced ultrasound physics work, how they are moving with the sound waves, with the compression and the rarefaction, what is peak reflection pressure and what is MI, and how they are following non-linear interaction. These three things are very, very important. Now, what are the application of these contrast enhanced ultrasound? Why we are talking about them that much? What are their clinical implications? So they can be used in non-vascular uses, like suppose you are doing hysterosalpingography. In hysterosalpingography, what happens with and without contrast agent? Here what we have given a USG contrast agent. So here we are able to see this tube. Okay. On giving contrast, we are able to determine the lumen, and they are coming out of the fimbriae as well. Here the contrast uses sonoview. So they are helping us to delineate more about the pathology in the lumen whenever there is any stricture present. You can even able to delineate much better on the contrast enhanced ultrasound. Okay. This contrast enhanced ultrasound is also used in vesico-ureteral reflux, so can be used in nephrology as well. So here we are seeing the bladder, ureter and the kidney, and this is a contrast enhanced ultrasound. We have already given microbubble contrast agent, so we are able to delineate the anatomy of this system very well. Whenever there is any stricture present, whenever something is obstructing the tract, there will be hydronephrosis. You will be able to delineate the anatomy with contrast enhanced ultrasound more without the non-enhanced ultrasound. Third use comes in the vascular uses, and it is one of the very important vascular uses. As we are seeing in this picture A, B, C, D, this A and C, they are non-contrast enhanced ultrasound, and these are the contrast enhanced ultrasound. But here you are able to see, you can able to differentiate. You able to differentiate a heart good here or here? You able to see the septa here properly or here? Because what is happening, whenever you want to assess valvular abnormalities, you want to see the wall motion abnormalities, you want to see defect in the interventricular septum, you need to see the septum very clearly, you need to see the walls very clearly. So what happens when you give them contrast enhanced ultrasound, these septums and the lumen or the cavity of these ventricles, they are much more comparable. We can delineate their anatomy much better than non-contrast enhanced ultrasound, and there will be lesser chances when give contrast enhanced ultrasound, less chances that sometimes we miss a VSD or ASD, because we are able to see the anatomy much better in contrast enhanced ultrasound. Other uses, liver specific microbubbles, and this is one of the good uses of liver specific microbubbles. Suppose this is a non-contrast enhanced ultrasound. Here you are not able to see any mass lesion here that much, but when we give the contrast, here you are able to see that here is something default. So we are able to see that there is a mass present over here in the liver, and the liver specific microbubbles which we use are like Levovist. They are Levovist, they are Sonovist. They are basically liver specific microbubble. They collect in the liver in the reticuloendothelial phase. Levovist and Sonovist. And very important liver specific microbubbles when we are getting a contrast, whenever we are having a mass which is isoequivalent to the liver and we are not able to delineate the anatomy as well, we give the contrast and then we are able to assess the anatomy. So this is all about second part of microbubble contrast agent. But one thing I want to emphasize here, that the contrast enhanced ultrasound is not used that much in our country. Why? Because it's very, very costly. Because of their cost, we don't use these contrast enhanced ultrasound that much, but we should know the physics about microbubble contrast agents, and we should be knowing that if sometimes we are not able to use MRI contrast agent or CT contrast agent, then this is a very good modality to do that. So this is all about microbubble contrast agent. What are the shape of microbubble contrast agent? What is the size of contrast agent? What materials they are made up of? What is the physics behind them? why we are using instead of MRI and USG contrast agent, what is the ideal microbubble contrast agent, and their clinical applications. Thank you so much.